All right, picture this. You're at dinner, you're mid-sentence, you're about to sound smart, and then hic. Great, you're possessed now. By what? Nobody knows. All we know is your body just decided, you know what would be fun right now? Random spasm noises. Welcome to the magical world of hiccups. Totally useless, incredibly annoying, and weirdly hard to explain without sounding like a cartoon character. Let's figure out why our bodies do this nonsense. And more importantly, how to make it stop before people start offering you water like you're choking on your life choices. What even is a hiccup? Okay, let's break this down. A hiccup is basically your diaphragm having a little tantrum. Know the diaphragm? That dome-shaped muscle below your lungs that helps you breathe? Normally it's pretty chill. Expands down, pulls in air, you live. But sometimes, it spasms, like a sudden twitch. And when that happens, it forces you to suck in air super quickly. And guess what's just vibing above your windpipe like a gatekeeper? Your glottis. Sounds like a fantasy creature, but it's actually the part of your throat that controls airflow into your voice box. When the diaphragm spasms, the glottis slams shut like, nope, and boom. That's the hic sound. So basically your diaphragm's like, let's party, and your throat's like, denied. And you just sit there, hiccuping through your date like a malfunctioning toaster. So why does this happen? Great question. Super unsatisfying answer. No one's 100% sure. Yeah, science knows what causes the hiccup physically. Diaphragm spasms and glottis snap. But as for why we hiccup in the first place, it's kind of a mystery. That said, we do know some things that trigger it. Eating too fast. Drinking carbonated drinks, swallowing air, sudden changes in temperature, stress, excitement. Or laughing too hard being a newborn, basically. If you're doing anything even remotely fun or human, hiccups might show up like, hey, can we ruin this moment? It's your body's way of reminding you it's still in charge, and it's got zero chill. But, is there a purpose? Weirdly, some scientists think hiccups might be a leftover reflex from before we were even born. Like, pre-birth training mode for your lungs and diaphragm. Think of it as a biological software update you never deleted. It might have helped babies develop the muscles they'd need for breathing later. Now it's like that one app on your phone you've never used but can't uninstall. Completely pointless. Okay, fine. How do you make it stop? The real reason you clicked. So, there's no guaranteed cure, but there are a bunch of hacks. Some of them work. Some of them make you look like you've lost your mind. Let's go. 1. Hold your breath classic. Increases carbon dioxide in your blood, which might reset your diaphragm, or might make you pass out. Either way, hiccups are gone. 2. Drink water, upside down. Who came up with this? Probably a wizard. But some say drinking from the opposite side of a glass resets the spasm. It's worth a try if you're cool with looking ridiculous. 3. Scare tactic. The idea is to shock your body out of the hiccups. But let's be real. Unless someone jumps out wearing a clown mask and screaming, your ex texted you, it probably won't work. 4. Swallow sugar or vinegar. These trigger nerves in your throat and can interrupt the hiccup reflex. Also doubles as a reminder that you'll try anything when desperate. 5. Pull your knees to your chest and breathe slowly. Kind of like yoga for your organs. Relaxation helps. Plus, you look like a thoughtful potato. 6. Wait it out. Sometimes you just have to ride the wave. They usually stop on their own after a few minutes, unless you've got chronic hiccups, which is a real thing, by the way. Then it might need medical attention. Can hiccups be dangerous? 99.999% of the time? Nope, just annoying. But if they last more than 48 hours, yeah, that's not normal. That's not even quirky. That's a symptom. Call your doctor. Also, if you're hiccuping after head trauma, a stroke, or while vomiting, don't watch a YouTube video. Go to a hospital. Now, final thoughts. So, to recap. Hiccups are your diaphragm, throwing a mini fit. They serve basically no purpose anymore. They happen for dumb reasons like soda or excitement. They sound silly, feel annoying, and occasionally ruin dates. You can try sugar, water, fear, yoga, or just sit there questioning your existence until they stop. Science doesn't fully understand hiccups, but your grandma's upside-down water trick, that might just do it. So next time you hiccup, just smile and say, well, My diaphragm's just trying to freestyle again? And then go chug a glass of water like your sanity depends on it. Hic. End of explanation.